Good day, everyone. This lesson is over glaucoma, cataracts, and neoplasms. I am sorry I'm not there today. I had something come up, so we're going to start with glaucomas. Our learning objective is going to be describe the pathogenesis of glaucoma and its effect on vision. And then our learning target is what is glaucoma and what are the causes, and then compare open angle glaucoma and closed angle glaucoma. Glaucoma is described as several eye diseases characterized by the increasing ocular pressure that leads eventually to the atrophy of the optic nerve and the ganglion cells of the retina. It is common, affects about 1 to 3 people over the age of 40. Early diagnosis and treatment can prevent progression of ocular changes and blindness. Glaucoma is related to the disturbances in the formation and circulation of the interocular fluid or the aqueous humor. Normally, we can see the aqueous humor being secreted by the ciliary bodies into the posterior chamber. Then it moves into the anterior chamber, and then the fluid is reabsorbed into the small veins. While in glaucoma, somehow the flow is disrupted and results in the accumulation of fluid inside the eye, causing that interocular hypertension and that increase of pressure. So we can see here, we've got a normal eye and we've got an eye with glaucoma. We can see that pressure increasing. Now there are 2 different types. We've got open angle and closed angle glaucoma. So we can see that normal flow. We can see that drainage canal is opened. There's nothing to stop that flow. But while in open angle, we can see that angle is still open, right? Like the canal is still open, but there's something obstructing it, right? The drainage canal is blocked because of that meshwork being blocked. While in closed angle glaucoma, we can see the pressure pushes against the cornea, blocking that tubercular meshwork, causing the iris and the lens to stick together. So we can see where that fluid drainage is not, the angle has changed on that lens, so that drain is not happening any longer. So glaucoma, the etiology of primary open angle glaucoma is unknown. This is the most common form of glaucoma. The angle of the anterior chamber through which the aqueous humor is reabsorbed is opened and there's no damage to it. It develops by itself and is characterized by the progressive, slowly evolving and elevation of interocular pressure. This can be measured, so all eye pressure is measured with the ophthalmotonometer applied to the anterior or the front side of the eye. Then we have closed angle glaucoma, which is characterized by the visible obstruction of the angle. Typically, this is produced by the iris during a contraction. So you can see open angle, there's nothing going on there. Everything's still working, but there is an obstruction in that tubercular meshwork, most likely. While in closed angle, you can see the iris, and it's contracted, so there's no flow, right? You can see the flow in the open angle, but there's no flow in that closed angle. Typically, this is seen as an acute onset of ocular pain and loss of vision, as well as redness of the eye. And ocular pressure is only elevated during attacks when that iris is contracting. So, both of these are slowly progressing diseases in most cases. There are some exceptions. Originally, it causes a loss of peripheral sight, which typically remains unnoticed by the patient. Diagnosis is made by measuring interocular pressure, and early diagnosis and treatment is essential so we do not lose full vision. This can be treated with drugs that decrease the production of that aqueous humor or reduce intraocular pressure. So, on that paper, I left them in the box up front where you guys turn them in. Just go grab yours. You're going to answer these 2 questions. What is glaucoma and what are the causes? And then I want you to compare and contrast open angle glaucoma and closed angle glaucoma. Pause the video, answer these questions. All right, we're going to move over to cataracts. Now, our learning objective is discuss the significance of cataracts. And our learning targets are what are cataracts and compare senile and secondary cataracts. So, cataracts are classified by the opacity or clouding of the crystallized lens. Most common cause of decreased vision in the United States is due by cataracts. Also, the most successful chronic eye ailment to be treated is also cataracts. More than 1 million people have had cataracts successfully removed and fixed. They can be either classified as senile or secondary. So, senile cataracts are the most common, and they are just caused by old age. Approximately 60% of all people over the age of 70 have some evidence of clouding in the lens. It's considered a disease of aging that has no obvious cause except for wear and tear of the lens. While secondary cataracts are caused by lens opacification as a consequence of either trauma, inflammation, or redness, things like diabetes and arteriosclerosis also predispose individuals to the formation of these secondary cataracts. We can also find congenital forms in infants as well. We kind of talked about that earlier. These cataracts develop slowly over the years. Typical complaints are going to be blurry vision. As the disease progresses, the visual acuity diminishes, and eventually vision is almost completely lost. Symptoms depend on the extent of that opacity of the lens. We can surgically remove cataracts to improve that vision, but patients will have to wear glasses or corrective lenses for the rest of their life. All right, and finally, we're going to move over to neoplasias. We're going to talk about 2. So, our learning objective is discuss eye tumors and with special emphasis on retroblastomas and melanomas. And then our learning targets are list 2 of the most important eye neoplasms. What are retroblastomas and what are ocular malignant tumors? Melanomas, sorry. So neoplasias of the eye are very, very rare. The only one that we're going to see pretty commonly is literally skin cancer of the eyelid. All other eye tumors are rare. So the 2 most common tumors that we're going to see are retroblastomas and malignant melanomas. Retinoblastomas are found in 1 in 20,000 children, and malignant melanomas are found in about 4 to every 100,000 adults. So, what is a retroblastoma? These are rare tumors, but still the most common eye tumor in infancy and childhood. It accounts for about 3% of all malignant childhood tumors. Some important facts to know about them: 5% of cases are hereditary. That means one or both of the parents have had either the recessive gene or have had a retroblastoma. They are typically bilateral, so they're going to be seen in both eyes, and they have a suppressor gene called the retroblastoma suppressor gene. So, these tumors grow as an interocular mass that fills the entire globe, as well as covers the optic nerve. Clinically, if a child comes in with a retroblastoma, we're going to see it as a white pupil instead of the black pupil we typically see. This will lead to enucleation, so removement of the eye, as well as probably chemotherapy. A malignant melanoma is the primary interocular tumor affecting adults. These tumors originate from pigmentary cells in the uvula tract, and the mass once again fills that entire globe. These, like I said, are found in 4 and 2 every 100,000 adults. So they're pretty rare, but still can affect people. So the spindle cell melanomas of the iris tend to grow slowly and have local restrictions, while the pigmentary cells of the uvular tract will fill the entire globe. Malignant melanomas of the cronids typically require enucleation. So on this slide, there are 3 different locations for this melanoma. We have one in the pigmentary cells, which will fill the entire globe. The spindle cells of the iris will kind of just hang out in that area. And then the ones in the cronids will require enucleation to treat that cancer. So that is the end of the presentation. I will see you tomorrow to start our lab. Lab is posted. Please review.